While cytology and biopsy are still considered the gold standard tests for diagnosing mesothelioma, there are some alternative biomarker tests that can aid in diagnosis when specimens are inconclusive or cannot be easily obtained. Some of these alternative biomarkers that are being studied and show promise include soluble mesothelin-related peptides, SMRP. SMRP is a cell surface protein that is overexpressed in mesothelioma cells. Elevated levels can be detected in blood and other body fluids of mesothelioma patients. Studies have found SMRP to be relatively specific for mesothelioma and that it may help distinguish mesothelioma from other malignancies. However, SMRP levels are not elevated in all mesothelioma patients, and it does not differentiate between malignant and benign pleural disease. As a result, SMRP is currently not recommended as a standalone test, but can provide supportive evidence when used along with imaging and histological examination. Osteopon, OPN. OPN is a glycoprotein that promotes tumor growth and metastasis. Researchers have found that mesothelioma cells secrete high levels of OPN, and it can be detected in serum, pleural fluid, and tissue biopsies of patients. Studies show OPN may be able to distinguish between malignant and benign diseases, with higher accuracy than SMRP. However, more research is still needed, as OPN levels may also be elevated in some other cancer types. When used together with SMRP or other markers, OPN could help strengthen diagnostic value. Fibulin 3. Fibulin 3 is a calcium-binding extracellular matrix protein involved in cell adhesion and migration. Recent studies found that fibulin 3 is highly expressed in epithelioid mesothelioma tumors but not in other common cancer types or in normal tissues. Detecting autoantibodies to fibulin 3 in patient serum showed good sensitivity and specificity for mesothelioma. Larger studies are still warranted, but fibulin 3 antibodies show potential as a minimally invasive marker. MicroRNAs, mRNAs. mRNAs are small, non-coding RNA molecules that play important regulatory roles in gene expression and have been linked to various disease processes, including cancer. Different tumor types exhibit unique mRNA expression profiles. Some mRNAs such as miR165P have been found at abnormal levels in the serum of mesothelioma patients versus healthy controls, suggesting potential as non-invasive biomarkers. More research is needed, but using mRNA profiling could help develop highly specific diagnostic signatures for mesothelioma. Hyaluronic acid, HA. HA is a glycosaminoglycan component of the extracellular matrix. Studies found that HA is overproduced by mesothelioma tumors and its levels are elevated in pleural fluid and serum of patients with the disease. While not specific on its own, when combined with other markers, HA measurement may contribute to diagnosis, monitoring response to treatment, and detecting recurrence. Mitochondrial DNA. Compared to nuclear DNA, variants can more easily be detected in body fluids due to being more numerous in cells and experiencing more frequent mutations. One study found that total levels as well as specific mutations were significantly higher in plasma of mesothelioma patients versus healthy or asbestos-exposed controls, showing promise as liquid biopsy markers. MicroRNA, protein, and metabolite-based markers. High-throughput profiling techniques now allow simultaneous analysis of multiple types of biomarkers in tissues and body fluids. Combining mRNA, protein, and small molecule metabolites into diagnostic signatures holds promise to greatly increase sensitivity and specificity for mesothelioma detection compared to individual markers. Some signatures are in early validation studies now, but this multi-marker approach could lead to minimally invasive tests with strong diagnostic power. While histology remains essential for a definitive mesothelioma diagnosis, emerging data suggests alternative biomarkers show potential as adjunct tools. Combining several markers into a multi-analyte diagnostic panel through blood or other fluid tests may eventually enable reliable non-surgical screening and monitoring. Larger prospective studies are still needed to fully validate new biomarkers and meta-signatures before they can be standardized for clinical use. Overall, research into non-invasive diagnostic methods is an active area that aims to improve mesothelioma patient care and outcomes.